I'm Scott Loughlin. This is the Data Chronicles, and here are your data points. Today's episode will be a bit different than those that we had in the past. A few weeks ago, my partner, Marcy Wilder, and I spoke at a conference held by the Council for Affordable Quality Healthcare, or CAQH, regarding 2023 trends in health privacy and perspectives on the future of how health privacy will be regulated. First, let me introduce you to CAQH and Marcy Wilder. For those who don't know Marcy, she is one of the leading health privacy lawyers in the world and a co-founder of the privacy practice at Hogan Lovells. She brings decades of experience and perspective on health privacy and is one of the few people with truly deep expertise in managing legal risks relating to health data. That's why Marcy and I were invited by CAQH to talk about health privacy at its 2023 Connect conference. CAQH is an alliance of health plans, providers, and related organizations who work together to make the business of healthcare streamlined and efficient. The conference, the CAQ Connect conference, brings together senior executives and thought leaders from across healthcare to explore how organizations are using data to transform administration, payment integrity, provider networks, member access, and health equity. Marcy and I were so happy to participate, and we wanted to bring our conference insights to our Data Chronicles podcast, so CAQH was kind to allow us to record the conversation. Thank you, CAQH, for the opportunity and for being such a great friend of the podcast. For all of our listeners, if you are interested in health privacy, its recent past, or the direction of future travel, you'll love this conversation. Enjoy.
We are going to spend a little bit of time today talking about the 2023 Health Privacy Hot List. And we're going to, it used to be, as you heard in the introduction, that when I was at HHS, I was the lead lawyer on the HIPAA regulations. Now, that was about 20 years ago, and it was a much simpler time when HHS regulated health data. That was the way it was. Not anymore. Today, HHS regulates health data, the FTC regulates health data, the state AGs regulate health data, and this is only in the US. So as you all know, the environment has become more complex. Now, we've been saying this for years, and if you are at all involved in compliance, data use, secondary use of data, sort of all of that, for a long time, 80% solution. We're never going to comply with all the laws perfectly, but we know what we have to comply with and we'll do enough to appropriately manage the risk. That's getting harder and harder because the enforcement environment is changing, and we're going to talk a little bit about that. So we also would like to touch today on the regulation of technology more generally, certainly generative AI. Probably heard of it. A lot of people talk about it. And then we're going to spend a little bit of time, if we have time, on cybersecurity. So that's the hot list. And Scott, why don't you kick us off talking about this battalion of regulators who are ready to roll and rolling on health privacy enforcement?
Yeah, thanks, Marcy. And one thing I would add to our list here is that we also have our very own Privacy and Cybersecurity podcast now. And with the permission of the folks in the room, we are going to record this session and eventually put it up on our podcast. So we are super excited about that, and thank you for the opportunity. So Marcy asked about the regulators, and I think the answer is she's exactly right, that there are many more regulators than we certainly had 20 years ago. And probably by the time I leave this room, there will be another regulator that is looking to get into this particular space. if you think of all of the various folks who have been kind of pushing into this area, obviously OCR, which is a division within the Health and Human Services, have been the primary federal regulator for healthcare plans, healthcare providers primarily. But importantly, that law, HIPAA, in the way that it was written, only has a limited application to specific types of entities and specific type of data held by those entities, meaning that there is so much more data that is not regulated by HIPAA and by the Department of Health and Human Services. So that gap that was created in the way that the HIPAA rules apply left opportunities for other regulators to start to get into the space, especially when healthcare and consumer sectors increasingly come together and more health-oriented data is being created by consumer products and consumer technologies. And that is where the focus has been with the FTC, which is another federal regulator, and also the state AGs and state entities. All three of those big groups have really come together and are regulating health-related information in different ways, subject to different sets of requirements, subject to different sets of priorities. And as a result, it ends up being all mixed together and resulting in a very complicated approach to trying to manage these risks, which, as you said, look very different than 20 years ago. So, Marcy, maybe my first question for you, as we start to pick apart these regulators, it's important to understand where their priorities are so that we can match our regulatory resources to those priorities. Where do you see the priorities of OCR and HHS with respect to HIPAA?
Yeah. So look, HHS, and this is relevant to the people in this room, has a very specific mandate around patient data, right? It's essentially data that's created within the healthcare ecosystem. So it's provider data, it's plan data, and that's their mandate, their remit. As in your business, that data is increasingly coming together with consumer-generated health data, social determinants of health. It gets, because that's really useful when you're trying to run businesses like yours. And so HHS has just a slice, and it is the HIPAA slice. So what are they doing with that? A couple of things. They are clearly breach-focused, right? There is the public listing of all those who have had breaches involving more than 500 individuals. There is a fairly robust enforcement process where they're focused on the HIPAA security rule and HIPAA security risk assessment. So that's something to pay attention to. And that train will continue. There will continue to be breaches. They're getting more sophisticated in the questions that they're asking. And I think we'll probably see more monetary settlements, more settlement agreements. Those are all public. They're easy to learn from. And I think that there's a fairly well set out pathway on how to comply. People have been complying with HIPAA for a long time. What's a little bit new is their increased focus on individual rights and access to health records and individual complaints. They put in place a process for managing those and timelines for managing those. So on the defense side, we're seeing more and more outreach around those individual complaints. For many, many years, it's not that they didn't take them seriously, they did, but you could pretty easily sort of address them. You've got to correct the problem. You could do it informally. It was pretty easy. It's more formal now. We're seeing more and more questions around who is covered. They're really pushing their jurisdiction. It used to be you could carve out pieces of your business that really were not HIPAA covered. You can still do that, but HHS is pushing on that boundary more than they ever had. I also think that more people know about the complaint process. And so it used to be just sort of access requests, but now the volume of individual complaints is going up. And so we're just seeing more and more, and they're changing and getting better at, from the enforcement perspective, at pursuing those kinds of cases. So those are the two I would put out. That's what we're seeing most of in 2023.
Yeah, makes sense. And, as you see kind of the development in this space, where do you see the next 2, 3, 4, 5 years look like?
I think you're going to see more and more coordination with the FTC. I think that there's going to be HIPAA compliance. And then I think there's far more communication. They compete with each other. But they are starting to communicate more and more and work together. And I think you saw that in the guidance that was put out not too long ago. There was a joint guidance from the FTC. It wasn't a guidance, it was a warning letter, I suppose. Nicer way to say. I think guidance is a nicer way to say it. It was a warning letter sent out primarily to health systems and telehealth companies, warning them of the risks of tracking, the use of pixels and other kinds of tracking devices on websites. So HHS is focused on that from a HIPAA perspective. They gave their guidance last December. The FTC, and I'll ask you to talk about some of that. The FTC certainly has been very active in that field. That's going to continue. That's going to be a very hot topic, and I think we're going to see a number of lawsuits. We are already seeing a number of lawsuits about that. So that is the sharing through pixels, cookies, websites, apps of data between health plans, between health systems, usually in big tech or small tech companies. That's going to be a big area of focus. But why don't we talk a little bit about the FTC? That leads right into what they're doing, particularly on these tracking devices, which is a hot topic.
Yeah. So, I think the way that the FTC has really been engaging in the space recently is looking at, I think, probably a dynamic that everyone in the room has seen, and that is there's fewer distinctions between traditional healthcare organizations and consumer organizations. As everybody knows, it's much more difficult to operate a business in the healthcare space than pretty much any other sector in the United States. It is so difficult to understand what all of the various rules are, and you almost need to have a law degree and 20 years of experience just to know what it is that you can do in any particular moment. But as we see our workforce kind of continue to blend from folks who maybe are moving between careers, and we see people only spending 2, 3, 4, 5 years in a career before moving elsewhere, you don't see those long-term health careers that perhaps you may have seen in the past. In fact, for better or for worse, people are in healthcare, move out of healthcare. People are out of healthcare, move in healthcare. And as a result, quite naturally, they're bringing and drawing upon their experiences from their prior lives and saying, hey, you health plan have been doing this, marketing stuff all wrong. Like, at my big tech company, we have so many better ways of doing that. Why don't we can just do this by adding all sorts of different cookies and trackers and all sorts of stuff on our website with the best intention, right? Just to continue to improve operations. But what is lost in all of that for folks who have not been in healthcare is realizing, well, healthcare is different. It is not the same as running an e-commerce store. It is not the same as running a social media platform. In fact, we are subject to different rules, and we also need to be sensitive to the fact that the data is much more sensitive than data that may be collected about what's sitting inside of your Amazon cart. That dynamic is really where I feel the FTC has focused. And in particular, trying to reinforce to organizations who may not be subject to HIPAA because they are not a traditional healthcare provider or a traditional healthcare plan, but instead saying, hey, you still get very sensitive information. And as a result, we expect you to treat that information with a heightened degree of care than you do with other consumer data that you collect. That dynamic has played out several times over the course of the past year or so in 3 or 4 cases where they brought cases against GoodRx, which is a couponing company, brought a case against BetterHelp, which was an online behavioral therapy company. They brought a case against a genetics company consumer. And so you start seeing these healthcare organizations who were providing a consumer-oriented healthcare product, and they were trying to use the data in the same way that any of the other companies were. And the FTC said, no, you can't do that. You actually need to get things like patients' consents to be able to use that data. You can't just freely share it with Meta or Facebook to be able to have targeted advertising on their platforms. And that dynamic, right, where you say HIPAA didn't apply, but we're still going to treat that data different than everywhere else, is really where the FTC, in my view, is spending their time and energy. And as you all think about your operations, where you would want to make sure you're being sensitive to those same considerations.
So I think this point about consent is a very important one because it's changing, and particularly for HIPAA-covered entities. And I say that because the things we've talked about so far, HHS is pushing its jurisdiction, be more careful about how you hybridize and document that. Fine. You know how to do that, and it's addressable, right? And pixels and tracking, the message really is look at what you're doing, limit what you're sending, look at the terms, because the companies typically push liability on the users, meaning the businesses that are using. So there's kind of a playbook you can follow to manage your risk around it. Consent, I think, is a little bit different. And that's because, I'm just going to go back 20 years, because when the HIPAA regulations, as many of you know, there was a policy choice made not to require patient consent to use information for treatment, payment, and healthcare operations. No consent required. That information was to flow within the healthcare system freely because a policy decision was made that that's what was best for patients, providers, plans, for the ecosystem itself. What's happening now, that wasn't true for marketing, by the way, right? You always needed consent/authorization for marketing. That was the line. Today, with the trackers, right? So this not consent-driven business is really now in the crosshairs of the FTC, which is saying, for consumer protection purposes, if you want to track this kind of data, sometimes you're using it for marketing, but sometimes you're using it for other things like healthcare operations, depends what the use is. Even then, for sensitive data, before you track in this way or disclose to big tech or small tech, you need consent. And I think both from the FTC and from the new state health privacy laws, we're going to see a big change in when consent is required. That's going to impact how plans and others can use this data and make secondary uses. And that's different than risk management in the sense that you really have to do something different in order to be able to use the data. So,
I mean, I want to follow on that point, Marcy, because I think it's a really good one, including what the policy decision was, 20 or so years ago. Because one of the dynamics that we are currently seeing in 2023 is that increasingly patients and individuals are at the center of being able to gain access to their data. You talked about that as an enforcement priority, but also to start to have rights with respect to their data, to have the ability of deleting their data, to have the ability of getting copies of their data, moving data from one platform to another platform. All of these are rights that people have articulated as over years, but weren't generally applicable until the GDPR went into force in Europe, and then has slowly made its way over to this side of the Atlantic. One of the other policy considerations that was made 20 years ago was that HIPAA, even for HIPAA covered entities, is a floor, not a ceiling on health privacy. In other words, that means that states are able to regulate and restrict uses and disclosures of healthcare information in a more restrictive way than what HIPAA does, and you have to comply with both. So maybe you can talk a little bit about that policy decision, including that now we're seeing the tension with all of these new state laws come into play as organizations need to grapple and deal with all of them.
Yeah, it's a really good point, and it's another way that HHS perhaps is seeing its sphere of influence shrink, which they may have feelings about. And what I mean by that is the policy choice that was made around preemption and the preemption of state laws is that where state laws were less privacy protective, they would be preempted. Where state laws were more privacy protective, they would not be preempted. You needed to comply with both. And now, past year, look at 2023 and the laws that are in effect and about to go into effect in 2024, they are simply more privacy protective. One, they're more privacy protective. Two, it's a little bit complicated because some of them have HIPAA carve-outs, but only some, and they're limited in scope. And there are questions about how it impacts, for example, research and other areas. And so the landscape is becoming more complicated. And I think what we're going to have to figure out is, and that we haven't figured out yet because we haven't seen how these laws are going to be enforced really, is I think it's going to continue to be impossible to comply 100% with everything. So we haven't figured out what I'll call the new 80% solution about what do you do to appropriately manage the risks for your organization.
Yeah, I think that's a really important point, including that, now these state laws are regulating data that you would never have to previously be concerned about, like employee data or data relating to your business context, your healthcare providers, for example, your healthcare providers' staff, for example, now could be in scope in states like California. We're running, last I checked, maybe 12, 13 states that have laws that they passed that generally apply to all different types of data within those states. If we're invited back next year, that number probably will be closer to 25 states or so. So there's been a rapid expansion in the way that states are handling this. And maybe, Marcy, I'd ask you to talk about another wrinkle here, because what is happening is that we're not only seeing the data be regulated in a more restrictive way, but increasingly we are now starting to see technology itself be regulated in a way that maybe hasn't been done before. In other words, we've always been thinking about, hey, you can use and disclose data in XYZ ways. Now we're moving in the direction of saying, well, you can use and disclose data in XYZ ways, but you can only use this different types of technology in 1, 2, 3 ways. Can you talk a little bit about that trend and where it's headed and how that's impacting businesses as they're looking to embrace innovation?
So look, I think that when we talk about the regulation of technology itself, the things probably furthest down the road in the US is facial recognition, but we're also seeing what comes up most often right now is generative AI. And how will it be regulated? And will it be regulated, right? And one of the challenges around that is business has to operate. And if you don't use these tools, you may well fall behind. Nobody wants that. And so how do you balance the current legal risks with the benefits? This comes up generally in 2 areas for companies. The first is usually employee use of generative AI, and a lot of companies, a lot of health plans have guidance that they've put out. We've helped a number of companies with that around do's and don'ts, essentially, around some companies have just banned it and said you're not allowed. Others have said you are under limited conditions and put out do's and don'ts. So there's not an industry standard around this yet, but that's usually the first thing that comes up. Second thing that's coming up is really about enterprise use of generative AI. And that is where, right, there is, the Google Bards and the ChatGPTs and Adobe and Microsoft all have products that are available to help you apply AI, generative AI. You've been using AI for a long time, but generative AI and these new tools using your data. And to do that, you've got to pay attention to protecting the privacy and the IP rights that live in that data. There are ways to do it. There are ways to navigate the contracts and the end user licenses, but there's sort of a checklist of things you ought to be paying attention to as you think about how you are going to let your data, or how you are going to use your data for your business and protect it against what you don't want is a third party using your data, and particularly your PHI, to train somebody else's, an algorithm that somebody else is going to use. So there is, again, I think this is manageable. I think it's doable. And I think right now, the lawyers are heavily involved. Like, we do a lot of this work, but like anything else, it's going to sort itself out. And then there will be an industry standard, and all of that will go back in-house, as it should. But we are definitely at a point in time where we have a lot of this business. There's a lot of advising that gets done and a lot of training in-house so that you can take those tools forward.
Yeah, maybe if I can add on to that, which I totally agree with, but I think one thing that is often lost sight of is when folks say, well, there's not an AI law yet, right? So there's not necessarily something that I need to do. That may be true in most places, at least in the United States. I can promise you that it's coming. And so you need to anticipate what those laws are going to look like. In California, it will. I'll bet you that one. Maybe not at the federal level, but the California, I bet it will. Then second is, importantly, AI is a technology, just like an automobile is technology, or a computer is a technology. But everybody recognizes that it itself is not exempt from other laws, right? In other words, all of the many other laws that we are governed by in how we manage legal risks or particular risks that they're trying to address still apply to AI. And so if you are using AI, for example, in connection with employment decisions, it's not a law that says you can't do it, but there are laws that says you can't discriminate. And so if you're using an AI model or an AI-enabled tool, which results in the discrimination, you're not in violation of an AI law, you're in violation of an anti-discrimination law, right? Or if you use a piece of technology, like we are often seeing, like bots and things like that open up on websites, and the websites, those can be the initial kind of entryway for patients or for partners to be able to ask questions. Where is my nearest doctor? Which is this doctor in network? All of those are maybe fine. And then you could also see then, well, let's say if someone says, hey, I'm having shortness of breath and I'm feeling chest pains. Well, then what does the AI do in that particular context? If I'm a patient and I feel like I'm talking with a healthcare provider on the other end of this computer, they should be telling me to go to the hospital right away. But the AI bot may not know that, may say, not understood, right? Or it may give you some hallucination and tell you something, the closest McDonald's is on your right? Any number of things that can happen. And importantly, AI itself may not be regulated in the way we're doing now, but all of those other laws, including negligence, including malpractice, including all of the stuff that we've worried about for years, still applies.
And all of this is about, you just have to be cautious. It doesn't mean don't use it. It just means you need to anticipate the risks and manage them. I want to spend a little bit of time on cybersecurity, and then I want to have a little bit of time for questions. So let's just pivot for a moment to cybersecurity. And just in terms of hot topics, everybody in the room by now should know how to manage a garden variety data breach. Happens, there's a process, there should be a plan, follow the plan. Fine. Really what folks are talking about in 2023 are ransomware and extortion events, which are obviously on the rise in the healthcare world. And specifically, where you have either a ransomware or an extraction and a demand for an extortion payment, what do you do then? And there really ought to be an addenda, if you don't have one already, to your incident response plan that runs through how those decisions will be made. And there's a process and there are different considerations. This is a thing that is figure-outable, but companies are different about it. They have different cultures, they have different views. We usually advise, we have, never say never is kind of the rule for this. But you do want to have a thoughtful process. Senior management needs to be involved. And then that leads to the other thing that people are talking about this year more than they ever have, which is what should be the involvement of the board. And so I think we've done more healthcare board trainings probably in the past 12 months than we have in the past 3 years. That's in part because liability for boards is going up. Expectations are going up. And typically what happens in the health plan world is that it's important to sort out the role of senior management versus the role of the board. And where everybody has a common understanding, there will be far less friction in a crisis situation, particularly where a decision needs to be made about paying a ransom or paying an extortion fee, yes or no, and what does that look like? So that's a lot of what we're seeing this year. I don't know if there are other things we ought to touch on.
I think maybe as I see the trends in cybersecurity, especially from a legal perspective, is historically, cybersecurity has been a difficult thing to regulate, right? In other words, each one of your organizations that you represent, are all aligned on the objective, trying to keep our data secure, try to keep our systems operational, try to make sure that we are able to, deliver the information to patients when they need it. All aligned on the objectives. I would guess that every single one of your organizations go a different path to get there. And that makes sense, right? There is an abundance of technology. There is an abundance of different solutions that you can look to try to manage to these risks. Also, importantly, right? Each one of us in this room probably have a different risk tolerance, right? Some people may be particularly risk adverse. Some folks are more risk tolerant. And that innate sense of risk and how you want to appreciate that is going to funnel in to cybersecurity related decision making. That has been the case for a very long time. And so the standard has been something similar to you need to have reasonable security. You need to have appropriate security. HIPAA has a little bit more specificity than most other statutes, but still gives large room for organizations to manage and adapt their cybersecurity programs to their organizations. That is changing. And that's especially changing in the insurance space. It's being led by the New York Department of Financial Services. DFS is what it goes by, which they are promulgating very specific set of standards that organizations need to meet. In other words, they're not going to say, "Hey, you can determine whether encryption is right for your environment." They're going to say, "No, you need to encrypt, right?" Or you need to determine that whether multi-factor authentication is appropriate for your environment. And it's like, no, you must do that. So now they're coming much more granular about what the expectation is. And that's being followed by a number of the other insurance commissioners throughout the United States who are promulgating kind of other versions of very specific cybersecurity related standards. And so while I talked a little bit at the outset about the number of privacy regulators, I think probably cyber regulators outdo them by 3 or 4 times the number of privacy regulators, because everybody is concerned about that, especially in the financial services and insurance area.
Yeah, I think that's right. And there is a model insurance law that I think less than half the states, privacy, cyber law, that I think probably less than half the states at this point have adopted, but it's on the rise, and that provides a good sort of roadmap for compliance efforts. Let's
one more thing I want you to mention though, Marcy, is about, we talked a little bit about DOI. Other big regulator going into that space is the SEC. You want to just give a quick update there, because I don't think we can leave a 2023 trends conversation without talking about the SEC.
Fair point. The SEC has rules about, they want to know about disclosures for material data breaches. And they have been very generous in how they are interpreting what is material. They want to know. And so we've really seen a big push by the SEC around this, and have had any number of arguments about what is material and what is not. But I do think that for public companies, you've got to look at those disclosures. You've got to do them timely. And we're seeing more and more investigations on this front from that regulator. Yeah, that's an important point.